The following portion of Daytime is sponsored by the Jasin Facial Rejuvenation Institute. The holidays are coming, and that means you'll be seeing plenty of people. So why not put your best face forward without surgery? You can rejuvenate your looks in an afternoon thanks to injectable fillers. Dr. Michael Jasin from the Jasin Facial Rejuvenation Institute is here to explain, and he's brought along a patient, Jan Butchek. Welcome to Daytime, both of you.
Thank you.
You just got back from Pittsburgh. There was an HD nationwide satellite broadcast that you were a part of. Tell us about that.
Well, it was very interesting. It was the first ever broadcast for CME in that fashion with high definition. And I went to 20 cities across the United States with over 1,200 doctors in attendance. And the focus was various injectable fillers and how we inject them. And we had live patient injections as part of that. So it was an experience.
All fillers are not the same, right?
No, they're not.
Different parts of the face where you should use certain fillers? Explain that for us.
Okay, well, depending on the composition of the filler and what the patient's needs are and their parameters will dictate which filler that we use. And we have a couple of photographs to demonstrate that. This first photograph illustrates a patient who desired a long-term correction, and we needed to do some facial recontouring. So we needed a more robust filler like Radiesse.
Okay.
Radiesse also is longer lasting, more in the range of 12 to 18 months, which made it a good agent to do that. So she's had cheek recontouring, the nasolabial folds treated, some brow elevation, some recontouring of her nose. We can change the shape of the nose non-surgically now with fillers.
Isn't that wonderful?
And longer-term fillers are appropriate for that. So the second patient that we have a photograph of had some restrictions in her work with regard to bruising. Mm-hmm. So we wanted to minimize bruising and swelling for her, so we picked a new collagen product called Evolent, treated her nasolabial folds, and also recontoured her cheeks to accomplish that.
Evolence.
Evolence.
Okay, that's good to know. And you can go in through the inside of the mouth to fill out the cheeks?
There's a technique I've developed called the invisible touch technique, where we can actually recontour the cheeks and the jawline by working inside the mouth, which minimizes bruising and swelling for the patient and gives them a nice, more youthful look.
Because as we age, that's where we lose a lot of our volume, isn't it?
Absolutely. What happens is, unfortunately, gravity takes hold, and the cheek fat pads descend, and we have some things happen that we don't like to see.
Jan, let's talk about your experience. Actually, you can look at Jan and tell us, what did you use on her?
Well, Jan's a good example of that because we had different areas that were treated in different ways. She initially came in for treatment of acne scars, and we used Restylane. Now, Restylane is a hyaluronic acid product, and one of their characteristics is they absorb water. So part of the correction that you see is because of what's being injected with the filler, but it also attracts water and brings water into the skin to plump up the skin.
Nice.
So it makes it a nice agent for things like surface problems with the skin, such as acne scars. We then decided to recontour her cheeks and treat some of the folds around the mouth, which we did. And we have a photograph, I think, of her before and after, so we can show as well.
It's great.
And we chose to use Radiesse to recontour the cheeks through the invisible touch technique so we could minimize bruising and swelling, because at that point, bruising and swelling was an issue for Jan. And then for the folds around the mouth, externally, we used Evolence, again, to minimize bruising and swelling.
I think bruising and swelling would be something that most of us would want to avoid, so that's great that you can do this. Tell us about your experience. What was it like, and did it hurt?
No, actually it was my first time that I've used an injectable, and I was very impressed with Dr. Jasin. He was so knowledgeable. He knew exactly what he wanted to use and where. I wasn't so sure about using the 3 different fillers, but he assured me I would get good results. The downtime was I was very impressed, as all of us were very busy. Didn't want to be out of commission, people noticing, and I was very happy. I would definitely recommend it and do it again.
How did people react? Did they say, hey, you've had fillers?
No. Hey, you have a new haircut, or just, it was very impressive.
And overall, you feel good?
Yes.
Yes. You look great.
Oh, thank you.
Hey, next time you come on, Dr. Jasin, you're going to be telling us about a new kind of lift. What's it called?
Called a Simplicity Lift, which is a 1-hour facelift which can be done under local anesthesia in the office.
Oh, can't wait to hear about that. Jan and Dr. Michael Jasin from the Jasin Facial Rejuvenation Institute, thank you both very much for coming in.
Thank you.
We'll be right back. The preceding portion of Daytime was sponsored by the Jasin Facial Rejuvenation Institute.